Right, okay, I'm 10 days post-op histo, total histo, and I've received a letter from the hospital that performed the surgery, which was the Princess Alexandra Hospital NHS Trust in Harlow in Essex. My surgeon was Miss Camilla L. Farrer. Okay, so Sonny was admitted today for a laparoscopic assisted vaginal hysterectomy and bilateral salpingo-oophorectomy. The operation was performed without difficulty. The tubes, ovaries and uterus all look normal. The liver and bowels look normal. We expect Sonny to recover well, and I will see him for a follow-up appointment in 6 weeks' time. Okay, so that's reassuring and comforting to know that everything is normal. Looks normal, which is good. I feel, in terms of that area there, I feel no pain at all. I feel perfectly comfortable with the way it's healing. I don't have any internal pain in that area whatsoever. The things that caused discomfort was being blocked up, being not being able to go to a number 2 properly. And that hurt quite a lot. It's now 10 days, and this morning's the first time really that I've properly cleared out and feel much better. I feel a little bit kind of like the onset of flu-y symptoms, like I'm not feeling 100% right, and I don't know what that is, but it just is what it is. I hope that it's not related to the surgery, and I have every faith that it's not. Maybe I've just overdone it a little bit. I was out on Saturday for a friend's birthday. Not drinking. I don't drink alcohol anyway, but it was just a lunchtime thing that we had some. Went out for lunch and had some cake and that. A few of us together, and also I went out yesterday. My friend who was visiting and taking care of me for a week has now gone home, and I went to my mum's for Sunday roast. And then this is what I wanted to really talk about, was symptoms of menopause, because the doctor that came to say everything was a success the morning after the operation, when I asked about menopause, she said that I would now be in instant surgical menopause, and I'm not certain of the symptoms or how that's going to be, being that I am a transitioning female on transitioning male. I don't know how I identify at all, but I think for me this surgery was the last surgery for me. It was nice yesterday visiting my mum, because she was really pleased that now it's all over. She said, it's all done, it's all over. She's glad that that was my last surgery. I suppose it's quite concerning when someone starts the transition process to, the medical transition pathway can be quite a long one, and it depends at what stage you choose to get off. As far as I'm concerned, what I have downstairs is okay for me currently, and that's as far as I want to go surgically. And the hysterectomy was, for now, definitely feels like my last surgical procedure for me becoming a man. They put it under gender reassignment surgery, which is fine for me, because I didn't want them bodily parts, and now they've gone. It feels good. So back to the thing that I was saying about menopause. I've been trying to be conscious of any changes that I've noticed in the last 10 days. And physically, I feel... yesterday morning I fell asleep on my sofa, and I woke up, I had socks on, I woke up and I felt like my socks were wet. And since then it's been carrying on that I feel like my feet are wet. I don't know if I'm sweating out on my feet for the first time, I'm not noticing any hot flushes, but my feet being wet are quite strange. It's quite a strange feeling that I didn't feel prior to this this hysterectomy. So I wonder if that's part of my menopause. It's not uncomfortable, so I don't mind that. I haven't noticed my anxiety levels raised in any way. I have noticed vivid dreams. I didn't used to have such vivid dreams. I had a lot of vivid kind of like nightmares, where like things that, you know, I dreamt I lost my flat, I lost somewhere to live, and it was quite traumatic. And you know, pre-hyster I wasn't really aware of having vivid dreams, but I don't know whether that's related to coming off the pain meds or the you know, the anaesthetic. So I'll see if that subsides. In terms of healing, yeah, it's all the three little scars are healing well. I'll just show you my my belly button one. They glued my scars, so I didn't have stitching. That's a glued one. That's one of them there, and the other one. Oh, I just pulled a bit of the glue off, I think, there. So that's that. That's healing very nicely. Nothing wrong at all. And yeah, so that was good. Like I say, my experience with that particular hospital was second to none. I'm going to write to the chief executive and just tell her my experience and just say how amazing it felt to be respected totally for the gender that I identify as, even though I was having a hysterectomy. And one of the funniest things I might talk about now is my mum's partner, her husband. They've been together for 20 years, and when I first came out to him, he said that he would never be able to use my name Sonny, and that's fair enough, you know. Different people manage the journey of transition, you know, of their relatives differently. And it's quite funny, my mum said, well, you know, he's a geezer. It's difficult for him, which I understand, you know. And I think one of the most touching things was he and my mum came to the hospital to see me after my hysterectomy, directly afterwards that evening, and my mum said that he had to phone up. He had to phone up the hospital and ask what ward I was on. So he phoned and said, my son has come in for an operation and I just wanted to know where he is in the hospital. And so the guy said, what's his name? Said my name. And he said, and what operation has he had? And he then, my mum said, put his hands like this. And then said a hysterectomy, and he said, no, your son couldn't have had a hysterectomy. And he said, yes, my son did. So that must have been incredibly challenging for him, but it was really nice that he said his son had. So that was quite touching for me, and yeah, that was nice that he brought my mum to hospital and came in there with her, which is nice. It was good. Okay, so now I'm 10 days, and apart from feeling a little bit fluey, everything feels amazing. I'm going to the toilet normally, and I've been eating normally ever since. I haven't gone off my food in any way. I'm just getting a little bit bored. I've been going out, like I say, a fair bit of the weekend, and I'm going out to the theatre on Wednesday with a family, a couple of people from my family that bought tickets for a show in the West End in London, and for a Christmas present, and I didn't know my op was going to be now, so yeah, I'm going to go into town and watch that on Wednesday evening. But I'm taking it quite easy because I don't want nothing to go wrong in the healing process, and it's only been 10 days, so I'm not overexerting myself. I want the outcome to be as successful as I can because the surgeon took her time to perform this for me, and I want it to be a complete success. So yeah, I will take my time in healing and not be overexerting myself. Yeah, so that's my update. I'll continue to update on the progress of this, and any symptoms of menopause I get, I'll be recording them